Now it's time for a forum entitled Digital Health and Intersection Between Technology and Healthcare. For this session, we have Prof. Patrice, Prof. Dato Mohan, and Dr. Hanis Binti Hasri as our panel speakers and Mr. Hasnain as moderator. For your information, Dr. Hanis is one of our IMU master students. Now, I am pleased to invite Mr. Hasnain to begin the session.
Thank you, Nurul. Can you hear me clearly?
Yep, sure.
Okay, and just to confirm, our distinguished guest, Prof. Dato Mohan, are you there? And Prof. Patrice? And
Yes,
Dr. Hanis. Okay,
yes, I'm
that's
here.
great.
Yes,
That's great. Perfect, perfect. So it's a privilege to chair this forum with all distinguished guests, and let me briefly introduce our panelists here. First of all, like Prof. Dato Mohan. Dato Mohan was Professor of Health Informatics and Pediatrics at International Medical University from 2005 to 2018. During this period, he was also Director of Learning Resources Division of the university. He continues to teach at International Medical University as a part-time as a part-time faculty. Sorry, my apologies. Okay. He continues to teach health informatics part-time at International Medical University and at Quest International University, Perak, where he is adjunct professor since 2018. He is advisor to MHIA Center for Stem Cell and Regenerative Medicine. He worked in the Ministry of Health for 30 years, from 1971 to 2001, including being head of pediatrics at hospitals Saramban, Ipoh, and Slayang. Professor Jai Mohan has, to his credit, 38 publications and 10 research reports on pediatrics, health informatics, and health policy. He has acted as temporary WHO consultant on telemedicines and advised on telemedicine development in developing countries. Our second panelist is Dr. Hanis Binti Hasri. Dr. Hanis is a Senior Principal Assistant Director at Ministry of Health, Malaysia. She has deep interest with healthcare big data and healthcare digitization, and currently a student at IMU completing her master in health informatics and analytics. In the ministry, her team is responsible for development of hospital information system in government hospitals nationwide. Last but not the least, our own Professor Dr. Patrice Francois Boxier. Prof. Patrice has earned his Bachelor of Science, Master of Science, and PhD in Computer Science from Paris Sorbonne University, France in 1981. He received the national accreditation for full professorship from French Ministry of Higher Education and Paris South University in 1996. He has been appointed professor in computer science at International Medical University in February 2020, in charge of developing new undergraduate and postgraduate programs related to digital health and health analytics. Prior to this, he had been head of School of Computing at Taylor's University and Dean of STEM faculty at International University of Malaya, Wales, after retiring as Emeritus Professor from La Roche University, France in 2014. Okay, so this is a brief introduction. You could always Google our panel names and you will get a lot of information about them. So just to brief this forum, the format would be, we'll be given every panelist about 15 minutes, 15 to 20 minutes to set the foundation. And title is very interesting, you know, digital health and intersection between technology and healthcare. So we have very nice blend of our panelists. You know, we have computer science background, we have pediatric, and we have from Ministry of Health also. So maybe we'll start with Professor Dato Mohan. Is that okay?
Okay, I shall try and share the screen now.
Sure, Prof. Yes, we can see that. Nothing.
You can see the screen.
Yeah, perfect.
Okay. Thank you for the invitation to participate in this forum. It's a very interesting. I've been following the conference for the last 3 days. You have had a very exciting program, and I hope our forum can add to the information sharing that has been taking place over the last few days. Congratulations on your 10th anniversary. Now, there have been many definitions of digital health. The one I like is from HIMSS 2020, which describes digital health in the following manner. Digital health connects and empowers people and populations to manage health and wellness, augmented by accessible and supportive provider teams, working within flexible, integrated, interoperable, and digitally enabled care environments that strategically leverage digital tools, technologies, and services to transform care delivery. So as you can see, there are several components to this definition, but the most important is it must empower people and populations to manage health and wellness. Now, the digitization of healthcare in Malaysia has taken place over many years. In the early 90s, we developed applications for administrative tasks, drug inventory management, and for finance and health management information reporting. Subsequently, we introduced patient-managed information systems in the 14 state hospitals, and automation was introduced into the national drug ordering system. This significantly reduced drug wastage and improved drug availability. Teleconsultation to support the lack of specialists in peripheral locations was the next part of the digitization of the healthcare system. It was used to support specialties that were especially lacking in specialists. This included psychiatry and oncology. In the same telemedicine infrastructure was used to conduct continuing medical education sessions between hospitals in different parts of the country. Finally, in 1997, we started work on our first electronic paperless and filmless hospital. This was opened in Selayang in 1999, and a second paperless and filmless hospital was opened in Putrajaya in 2000. This was linked to a paperless primary healthcare center. An exciting time was when we started work on the National Telemedicine Blueprint. The National Telemedicine Blueprint was one of 7 flagship applications that launched Malaysia's ambitious Super Corridor project. The telemedicine blueprint was appropriately labeled Leading Healthcare into the Information Age. Tan Sri Dato Dr. Abu Bakar Sulaiman was the Director General of the Ministry of Health at the time we launched the telehealth project. And he defined telehealth as the integration of information, communications, human-machine interface technologies with health and medical technologies to provide services to promote health and provide healthcare. And this would be through a national enterprise-wide health information system, which includes person management and health information, and which facilitates the sharing of health information and knowledge in healthcare settings, and which facilitates the management of health from the beginning to the end of life. You all, of course, know subsequently Tan Sri Dato Dr. Abu Bakar Sulaiman, after leaving the Ministry of Health, joined IMU as its president. Subsequently, the name e-health came into practice, and Tan Sri Abu Bakar once again called e-health the key enabler for supporting healthcare systems to create health and deliver healthcare. The focus here all along has been health rather than the management of illness. He pointed out that e-health would be a key enabler for supporting health systems, an enabler to share resources across domestic and international boundaries, an agent to reform healthcare from focus on infrastructure to a more decentralized and dispensed model, and the potential to improve quality and avoid needless duplication. You can see how slowly the concept of digital health is beginning to develop. This is a picture, little complex, showing the scenario of integrated health services as it was envisaged in the early 2000s. So we see the patient as the center of all health services. Patient can choose to access a digital portal specifically for patients and create personalized lifetime health plans and do health risk assessments. He could call a call center. He could make an appointment to see a doctor at a health facility where an electronic medical record would be created and summary information will go into a lifetime health record. Doctors at peripheral hospitals could consult specialists in tertiary centers through teleconsultation, and finally, continuing medical education would be made available to healthcare providers throughout the country, irrespective of where they are. More recently, our present Director General of Health has spoken about the Uberization of healthcare. Globally, many are now seeking innovative solutions to address the shifting demographics, increasing burden of chronic diseases, environmental changes, urbanization, globalization, and technological advancements. These common challenges that we face affect health one way or the other. Technology is disrupting conventional knowledge, practices, and business models of many sectors, including healthcare. Services and technologies such as online platforms, mHealth, Internet of Things, wearable devices, machine learning, big data, and artificial intelligence allow more efficient and effective healthcare service delivery. These disruptions are opportunities for us to solve some of the health-related challenges facing the world today. He goes on to say that Malaysia is witnessing rapid growth of the digital workplace with mushrooming of online health services. The term Uberization of healthcare is widely used in this context. This democratization of healthcare and the great potential to healthcare offered by the digital revolution is the new paradigm embracing the delivery of care. The safe practice of digital health should keep the consumers of healthcare at the heart of the adoption. Dr. Fazila, an assistant director at the Ministry of Health, pointed out that many game changers for tomorrow are now present. These include mobile devices, big data, artificial intelligence, social media, broadband services, the Internet of Things, and cloud services. So, WHO pointed out in their global strategy that digital transformation is disruptive. However, technologies like the Internet of Things, virtual care, remote monitoring, artificial intelligence, big data analytics, blockchain, smart wearables, platforms, tools enabling data exchange and storage, and tools enabling remote data capture and the exchange of data and sharing of relevant information across the health ecosystem is to create a continuum of care, have proven potential to enhance health outcomes by improving medical diagnosis, data-based treatment decisions, digital therapeutics, clinical trials, self-management of care, and patient-centered care, as well as creating more evidence-based knowledge, skills, and competence for professionals to support healthcare. Now, very recently, we have come out of the COVID pandemic. And at the World Economic Forum in 2021, this event and the response that the healthcare as well as governments have made to the pandemic has made this healthcare movement. And it turned out that the many challenges that were faced by healthcare services in providing appropriate care for patients and the way they overcome these difficulties turns out to be a benefit, advantage at the end of the day. It turns out most patients love the convenience and the time saved when they receive routine care, see specialists, access behavioral health services, or engage in physical, speech, or occupational therapy from the comfort of home. Telemedicine saves patients over 100 minutes of time, and 83% of patients indicated they will continue to use virtual visits in a post-COVID world. Similar changes took place in our healthcare institutions and facilities, which were initially so resistant in the use of digital medicine. And health professionals found themselves swamped and moved into the new healthcare settings and the use of digital health. There were many changes in the digital environment post-COVID. Patient visits became virtual. Electronic prescriptions were dispensed. Mental health especially was delivered online as per physiotherapy and occupational therapy and play therapy, and many changes took place in supply chain management, space usage, and manpower usage. Now, digital health actually describes the role of the healthcare provider in managing his health as an important component. And in this short description, we have failed to what have we failed to cover in digital health? We have been overly provider-centric, and the contributions of consumer-centric digital health not equitably addressed. These include things like consumer portals, peer-supported healthcare, consumer-supported health groups, mobile health apps for consumers, the use of sensors, wearables, and implantables, personal health records, robots that provide companionship, smart homes. All these are actually only now beginning to be explored, and we may not have given them the time and attention that they deserve because they can make increasingly important contributions to digital health. There are many digital tools. I don't have time to go through them. And many technologies were used during the COVID-19 pandemic. Again, I don't have time to describe them in detail, but end of the day, as WHO pointed out, digital health intervention should be integrated into the health system and not considered as standalone tools. Finally, we as healthcare educationists, how much have we recognized these changes that have taken place in healthcare? How much of this are we including in the education of our medical and other health professionals? And are we planning them for practice in the future, or are we training them for practice in a past that is soon to be left behind? Thank you for your attention.
Thanks, Dato Jai, for setting the foundation and sharing the history in the past, how Malaysia have achieved the current telehealth, situation. And you were like involved in the first paperless and filmless hospital and all that. I like the term you use, actually, telemedicine, should focus more on consumer health related, services. So let me invite our second panelist, Dr. Hanis Binti Hasri, to share her thought on this topic for 15 minutes. And then at the end, I will invite Prof. Patrice. Yeah.
Thank you. Thank you, Emilio, for inviting me to join this forum. I don't prepare any slides for today, but I am working in the Ministry of Health. A little bit about my background. I was a clinician for about 10 years before I joined the administrative side in the Ministry of Health, which currently I'm working under the Medical Development Division in MOH, and specifically my work related to the development of hospital information system for all government hospitals in Malaysia. Okay, so like Dr. Jai has mentioned earlier, actually the plan to digitalize our healthcare system has started many years ago, and now currently our situation is we are expanding the previous plan and also updating the previous software to fit into the current requirement, because as all of us know, the technology developed very fast, and I think about 2 to 3 years we have new technologies. And the most important thing at the moment that we are working out is to integrate various systems. So a little bit about the hospital information system in the Ministry of Health. We have 3 systems mainly. The first one is the Hospital Information System Proprietary, which is the ready-made HIS in the market where we buy, where we purchase and then install in the system. And then the second one is the homegrown system, the HIS at KKM, where we gather all the subject of matter experts in various departments and subspecialties to develop the system for our own use. And then the third one is the CPRC hospital system, where it was developed during the pandemic, and it was using the cloud-based technology. So with all these 3 systems, the challenge is how we gather data in between healthcare facilities. So now we are integrating it by using the Hospital Information Exchange, or in short HIA platform, where the end user, either the healthcare provider or the patient, can gather their own data from the system. So this is what we are working out at the moment. And in the future also, we are planning to develop the smart hospital in Malaysia, but it's in process. So I think, Mr. Hasnain, I think to make it interactive, maybe we can share thought, we can have a thought from Prof. Patrice also, because digital is very, it's a multidisciplinary concept intersection between health and technology. And the most important thing is that we use this intersection to manage health-related problems and also promotes well-being. So the sick person gets advantage from it, and also the health person also needs to use the digital health to keep their well-being, right? Yeah.
Yeah, I think Dr. Jaya and Dr. Hanis, you have set already the challenge, for Prof. Patrice, and let's see how technology could address all these challenges, right? So, Prof. Patrice,
Yeah.
are you there?
Yes, I'm here.
Floor
Do
is
you have my
yours
slides,
to-
or do you want me to share?
You can share on your side.
Let
You can
me
on the camera
see.
also. Because as our team is saying, humanizing, the technology. So if you on the camera, just now before this forum, there was a talk. Opening a camera and showing your face is actually a personal touch.
Oh, yes, I forgot about this. Okay.
Yeah. Yes, we
Um,
could see your slides, but could
you
you
can
show?
see me?
Yeah, and I can see you also. That's good. Yes, we can see in the slideshow mode. Yes.
Okay.
Go ahead, please.
So thank you very much for the introduction. Okay, so as you can see, I'm now I don't think it's has been officially announced yet at the IMU level, but I will lead the Center for Digital Health and Health Informatics under the School of Medicine. It has been approved by the management committee of IMU recently. And the center, I will explain to you what we are doing later, but in terms of digital health, these are the, okay, let me check. These are the things that we can expect from digital health. And first of all, improve communication between patients, GPs, hospitals, and everything. Yeah, and we can see it with telemedicine services. Then improve the access to the services, but also to the data. This is something that I will also explain a little more later, because it's something very important. And increase the quality of the services that are delivered. Increase the quality of the services that are delivered to the patients. Personalized medicine is something that is very important and that will be further developed in the future. But it's something that is also difficult. And I will explain why also later when I talk about data. And finally, reduce the cost, because this is something that hospitals, clinics are always trying to do. Okay. So telehealth is a general term that was that started in the 1990s and defined as delivery, facilitation of health and health-related services. So Dato was talking about it, and it's not new in Malaysia, so I will not spend too much time on this. Then there are other terms that relate to the same kind of thing, like telemedicine, telepharmacy, mobile health or mHealth, remote patient monitoring, e-prescription. All these are related to telehealth, meaning healthcare from remote, basically. So one of them that is very popular now is telemedicine, which relates to the remote diagnosis and treatment of patients by means of telecommunication technology. And sometimes it's also called mobile health or mHealth. There are many, there are quite many companies now in Malaysia working on this. We are in IMU working with a few of them. And I think this is the one of the most promising aspects of it. And it has been becoming very popular during the pandemic because everybody was at home and we had to use these services. Now, I will talk about some of the tools that we are using every day, at least some of us. We call them wearables, and these are sensors, in fact, that are either on our body or in some of our, for example, smartwatch. If you have a smartwatch, there are sensors in the smartwatch to detect, for example, your pulse, your heart rate. We also have some sensors, but for the moment, I don't think they are yet integrated in smartwatch, like the blood pressure. It's something that is a bit more difficult. but there are also smart clothes, hearing aids, electronic shoes, electronic socks. So you see, there are things I didn't even know existed, but it's something that is coming. Tattoos, and also some sensors that are put under the skin, and optical displays also. So all these are some new technology sensors that are being used. It's still sometimes experimental, but some of them are quite popular now, like smartwatches. And you see then we have some kind of a body area network, local network, in fact, that is connected to your smartphone through Bluetooth. And you can share your data. You can share your data to the smartphone using Bluetooth. And then all the data that are on your smartphone, you can connect them, you can exchange them through Wi-Fi with a router, and you can connect them to other websites or GP, clinic, anything. Okay? So all this is integral part of personal analytics. It means that it can be used to analyze your condition, measuring your physical status, recording physiological parameters, informing schedule for medication. And this can also be part of personalized medicine. Okay, so all this. Now I want to show you some pictures related to smartwatches. These are some of the things that you can see when you have a smartwatch and you connect it to your smartphone and on your computer also. And you can see, for example, your activity on the left side, the steps, your calories, kilometer, move minutes, if you have achieved your daily goals and your weekly targets. And then you have the heart points to see the condition of your heart rate, energy expended. And then you see how many steps you have every day and steps on a week or month. So this is something that you can see for yourself, but you can also share with your GP quite easily. And then they can use it to see if you are in good condition and tell you what to do next. Then specifically on the heart rate, you can measure it every day. Then you can see monthly what happens, and also week by week. And some sensors on some watches, they are able to detect if you have some anomalies in your heart rate, like adrenaline. Now there are some other specific devices. Probably you have heard about imaging, medical imaging, but in addition to the typical sensors that we use on medical imaging, we have new stuff like ultrasound imaging that are very useful for some application. And if you are interested, you can check these links on the NIH, and there is a video on YouTube on this one that explain to you how ultrasound is used. And this is something that is complementary to other technologies and very useful as well. Next, digital health is not only applied to medicine, medical condition, but also to pharmacy. And there is a very interesting report from IQPC where they present 6 ways pharmaceutical companies are using data analytics to drive innovation and value. And these are these 6. The first one, accelerate drug discovery and development, which has been done for quite some time now. Optimize and improve the efficacy of clinical trials. Target specific patient populations more effectively. Better insight into patient behavior to improve drug delivery and effectiveness in healthcare outcome. Then improve safety and risk management of drugs, and gain improved insight into marketing and sales performance. The one that is very important and became very important in the last 2 years is this one, accelerate drug discovery and development, because AI data science was used very much for the mRNA vaccines. You know, the Pfizer, Moderna, and especially have been very much involved in this. The discovery time has been reduced a lot because they were able to use these technologies based on AI, artificial intelligence. Now, digital health in Malaysia. So this is a summary of a report coming from Asia Pacific Digital Health Ecosystem Key Trends. And sorry, the source is PwC. sorry. Okay, and so here you see that there are different kinds of company, what they offer, and the future growth areas. So for example, in terms of digital wellness platforms, we have Naluri, MH. Teleconsultation, we have Dog, Dr. On-Call, Dr. Anywhere. Telepharmacy, Doctors, it seems. Wearable tech, we are not sure yet. There are some companies, but we are not sure. InsurTech and digital care management, we have some companies as well. We are working with some of these, and we plan to develop some joint projects with some of the at the center that we are launching, and then will become effective early next year. Next, we have also some key highlights from the same survey that are very interesting. Like 63% of people invest in their physical and mental well-being for a better lifestyle. It's quite a general comment, and we don't know exactly what people do. When they 63%, yes, they are concerned about their health, but what they do exactly? When we have this one, 45% monitor their health using wearable devices, fitness trackers, and apps, which is very important. 45% self-diagnose symptoms and treatments online prior to seeking consultation. 42% purchase wellness supplements via online platform, and 35% actively seek the lowest cost option for medical treatments. But in fact, if you check the details of this, you can see that it's mostly young people between 18 and 35 mostly. And yeah, this is explained here. So if you're interested, you can check the slides later, and you can access these documents, and you will see the details of this very interesting study. Now, the challenges of digital tools for healthcare. First, nurture the next generation of digital health experts. We don't have enough experts. And so one of the things that we are doing at AMU, we have created this Master in Health Informatics and Analytics. And also we have launched recently the Bachelor in Digital Health. So we are proposing, I think we are the only one at the moment in Malaysia, and one of the first in Asia. It's quite popular in some other countries, but in Asia, not so much yet. So nurture the next generation of digital health experts is one of the challenges and one of our objectives. Then the need to adapt technology to help meet challenges. Yes, technology is coming, but mostly young people are using. We have to develop this and to help all the people to use these technologies as well. Challenging most health economies across the world, yes, because it's a new technology, so it's disrupting. Acknowledge that cost of healthcare is rising, yes, it's another thing. Then ICT play an essential role in sustaining the future health industry. Yes, it's also a challenge because it's moving very fast, and we have to adapt. And healthcare is lagging behind other industries in using technology with service users. Yeah, we have to be careful, in fact, when we use this technology for healthcare, because if mistakes are done, it's a patient's life that is at stake. So this is also something that we have to be very careful with. Now, this is the point I want to highlight, data, because all of this only works when you are able to collect data from patients using wearables, using the exams that you get when you see your GP or you go to the clinic. But if you want to develop a personalized medicine, for example, you have to be able to integrate your all this data coming from different sources. And this is a very big challenge because it's not an easy task, but it's also dangerous. And every day you hear about problems of data breach and data being stolen. Recently, it happened in Singapore, it happened in Malaysia, but it happens everywhere in the world, all over the world. And cybersecurity is not good enough at the moment. This is the problem. So all this digital health will only be able to develop faster if we are able to find solutions to this problem of data integration and cybersecurity and privacy. So these are the programs, the activities that we have in the center at IMU. So we have the Master in Health Informatics Analytics that has been launched in September 2021. We have the Bachelor in Digital Health that has been launched recently in September 2022. And we are also developing micro-credentials and continuing CPDs, continuing professional development module that we have not advertised much yet, but we are going to advertise very soon so that more people can be involved in this and so that we can advocate for the development of digital health. So this is my last slide, and so I'm open for the discussion now. Thank you very much.
Okay, thanks, Prof. Patrice, for addressing the challenges. And if I summarize, you have talked about software and hardware infrastructure and more on data, And I think another element which I think we'll forget always is people or our patient or nation, the users, So that's good. So let's open the floor for the questions and question and answer session. So dear participant, feel free to post your questions in the chat. And we have first question from Dr. Asma. How ready are we as a country in terms of infrastructure and citizen readiness to take full advantage of this technology? Yes, anyone would like to share? Yes, Dato Jai, maybe?
Okay. Now, very interestingly, an experience not only in Malaysia, but in other parts of the world show that consumers are actually quite quick. The need is theirs, and therefore they are quite quick to start using any technology that becomes available. In fact, consumer groups have been pressure groups to try and push the health profession forward in delivering services where there are gaps. Now, is our infrastructure up to the mark? Actually, infrastructure has never been the challenge. If I give you the example, there was a physician in Sarawak. He saw the telemedicine setup, the teleconsultation setup we set up in West Malaysia. 21 hospitals with high-end telemedicine systems, and he felt that Sarawak was left out of the planning for telemedicine. So what he did was, in every hospital, there was rural or bigger hospitals like Sibu, Kuching and Miri, smaller hospitals like Kapit, Bintulu, and so on, Semangat. He got them a PC each, gave them a scanner, gave them a webcam. And remember, the webcams 20 years ago were very low resolution webcams. And he set up a telemedicine network using store and forward telemedicine. And at the end of the day, after our high-end telemedicine equipment became out of date, companies refused to service them anymore. The low-end network telemedicine in Sarawak still went on. And up to today, some version of that is running. So the question is, infrastructure, you can adapt the services to the infrastructure. When you cannot do live web conferencing, you can do store and forward web conferencing. So technology is not the issue. Infrastructure is not the issue. The issue has always been change management. And healthcare providers are actually very reluctant to change. And the higher they are in the hierarchy, the more difficult it is to get them to adapt and adopt new technologies. So I think don't let technology be the challenge. Readiness, people are ready. You got now, COVID-19 did something very exciting. It got healthcare practitioners on board. It got health institutions would not use information technology, suddenly forced to use information technology. And once they recognize and adjusted to these new challenges, all of a sudden they don't want to go back because they see the advantages, they see the benefits, they see the positive outcomes in patient care and delivery and supply chain. So I think as WHO said, we will not go back. We must not go back, and don't let infrastructure or readiness be an issue anymore.
Okay, thanks, Dr. Dr. Hanis, anything you would like to add?
Okay, regarding the infrastructure, I agree with Dr. Jai. Actually, even 5G, 5G in Malaysia, the infrastructure is managed by the Digital National Berhad, DNB. So they are planning to cover the whole Malaysia, the entire country, I think by 2025, if I'm not mistaken. But you can go to their website and see which part of Malaysia have 5G connectivity already. So if you see a small short pole in your area with a rectangle plate, then it means that your area is 5G ready already. Okay, that's number one. And Malaysia is pushing very hard to get 5G. Even in the Ministry of Health, we have program to involve the state hospitals to have 5G technology in the hospital. So for example, the remote consultation, the remote surgery, but still is in the working process. And then secondly, also like Dr. Jai mentioned, the change management is the hurdle, and COVID really push the technology in the healthcare setting. For example, the CPRC hospital system, because of COVID, we managed to put the HRS on cloud that is based in Pusat Data Sektor Awam, PDSA, governed by Mampu. So because of this cloud technology, we able to share data across the hospitals. So, but when we want to deploy the system to hospital, because my unit is responsible for the HIS, we go to the hospital, the most difficult part is to convince the end user to use the system. The connectivity is there. Maybe the hardware we don't have it, but because of cloud, you can actually access the HRS from your phone, from your tablet. But the end user is always the one that is reluctant to use because they are, because like, for example, small hospital, if you use manual, actually it's very fast already to do your work. So if you use, because sometimes you have to understand by using system, it is not only reduce one step of your work process, but sometimes it add another step to your work process. So this is why the end user reluctant to use, but the director of the hospital or the facility have to convince the end user to use it. Like Dr. Jai mentioned also, once they use the system, they don't want to go back to manual. Yeah, that's my thought on it.
Yeah, I think you have raised very valid point, like end user, the behavior, and yes, and change management, as Dr. also highlighted. Yes, Prof. Patrice, anything you would like to add?
Not much on this point.
Okay.
I don't know much about the Malaysian situation.
Sure.
Not in
I think one of your slides have all the answers, where you have shared the programs you are going to run.
Yeah.
So once they join the program, they will get all these challenges solved. Yes, back to the audience. If you have any questions, please post in the chat. Okay. I think Datu Jai, you mentioned about blockchain, right? Could you elaborate more? And I think that could even address the concern of security, which Prof. Patrice highlighted, and data breaches. And would you like to add something on blockchain and how far we are in healthcare setting, implementing this?
I'm thinking that Prof. Patrice may be a better person to answer the question of blockchain. Clearly, it is going to address many of our issues about security of health data, but it's only part of the solution. That it starts with mindset, it starts with planning where security is, security as to support privacy and confidentiality. So the technology is a very small part of that solution, but specifically the role that blockchain can play maybe Prof. Patrice is more qualified to address.
Sure. Prof. Patrice, over to you.
I think blockchain is it's a possible solution, but we've talked about blockchain for many years now, and some people don't believe in it anymore because of the problems there are with cryptocurrencies. In fact, cryptocurrencies are using blockchain technology, but there are some other issues associated with the cryptocurrencies. So yes, it's a possibility to use technology, but it will not be enough, yes, because the biggest issue with the cybersecurity, the safety of our data, is connected to people. People are what we call the weak link, the weakest link in the problem. And when we talk about social engineering, it means that hackers are able to manage to convince people to give them some information. You see, you receive emails, so now we know, but still some people are conned just by receiving some emails with some link that they click, and then they give you some data. And another thing that is even worse is you get a phone call from someone and they convince you to give some information. And then they will access not only your data, but they can access your computer or some other computers. And this is the biggest problem at the moment. And we don't know how to solve this at the moment because it's human problem. Technology we can solve. Human issues like this, we still don't know.
Yeah, when you were elaborating this scenario just now, AI was popping in my mind, like if we could incorporate AI and it's like change of a behavior, like we never receive a call from this kind of people regularly. So our AI should actually take charge of our conversation and, censor the information.
The problem is that we are humans and we have emotions. And some people know how to talk to you and they can convince you. So maybe one of the solutions, I was thinking about this some time ago, is to have a second AI, a technology-based AI, and instead of you taking the phone call, your AI would reply and would help you and would tell you, be careful. So maybe that would be a possible solution, to develop some AI that would second you, in fact, and they would help you to identify the problem. Because as humans, we are weak and we can be conned very easily.
Yeah. So you're saying in summary to have scanning behind of the person who you talk to via AI.
Exactly.
Software. Yeah. Perfect. Yeah. Dr. Hanis, you have highlighted a very prominent issue or challenge of interoperability. Like you have highlighted that there are different applications or different hospitals, they have different systems and they're not talking to each other, and how. So what do you think, how we could resolve this, and what would be your thought or saying in this regard?
Okay, thank you. Currently, I think every unit and every division or department in the country, or everyone, they want to have their own customized system, right? So for example, the notification division, they created their own system. The hospital created their own system. The clinic, the public health clinic created their own system. But then there are no data sharing process that you can transfer from the public health to the hospital. So one of the there are many ways actually. One of the way is to have a cloud platform to put the data. But if you put the different application in the cloud using based on if it's built based on the different languages, it also cannot talk together. So moving forward, actually, we are looking at using the HL7, which is the health level 7, and also the FHIR, fast healthcare interoperability resources, where it sets a standard to define how the healthcare data can be shared. So now we are working on to set this standard. So the HIA platform will use this standard, and moving forward, all hospital information system or any system in the Ministry of Health, we will enforce using this technology. So it will allow us to, data sharing, and also if you want to retrieve the data, it will be easier. Yeah.
Yeah, very valid point you have raised, like to have standards to follow for
Yes.
all hospitals and all.
Yes.
Very right. But I think I would suggest the government have a greater role to play, because it's a challenging situation. Yeah.
Yeah. So if you want to create a system for whatever reason, there are two main person that is very important. The first one is the business analyst, and then the second one is the system analyst. So the system analyst is literally is the programmer who does the coding, the architecture of the system, but the business analyst is the one that sets up the business process and explain how the application will work. And also usually the business analyst will be the one that deal with the end user. So for me, my position, I have a medical background. So my team act as a business analyst, and then the information technology department act as a system analyst. So when we want to deploy the system to the facility, we will go together hand in hand. So we converse together, and if we find trouble, like we need to customize the system according to the requirement of the specific hospital, we will discuss among ourselves. Yeah.
Yeah, and I think this reminds me, like if we could get this integration at national level and then later on international level, that could avoid, I was reading one article, could avoid another pandemic if we could have information.
Yes, yes. Actually now also we are, so now hospital we have our own hospital HIS, and now we are trying to integrate, like transplant unit, the e-notification unit, the public health services unit. We are working together to integrate everything, and then part in this HIA, and to make it the integration seamless, all patients in the government will get their own MHI identification number. So if you go to any healthcare setting, you just give your MHI number, because different like police officer, army, they have different ID, right? So if you use the MHI, you don't have the problem of entering the wrong data, wrong space, wrong dash.
Okay, Prof. Patrice, you raised one point there about personalized medication or medicine, and you gave a COVID-19 example. So could you elaborate further, like you're saying, like simulated environment could reduce the time in drug development? Is that what you want to highlight?
In fact, there are two different things. Yeah, in fact, drug discovery has made very strong progress using AI, and the time to develop new drugs has reduced considerably. But personalized medicine is another aspect. It means that, in fact, we would be able to give the right medication at the right moment to patients, but for this, we need to know the patient very well. So we need to get a lot of data, the history of the patient, his condition, his current condition. And it means that we are using wearables, but we are using also data that are somewhere in some hospitals, clinics, GPs, and all this data. For the moment, we don't know how to integrate them. It's the same problem of hospital information system not connected. So this is the problem of data integration, generally speaking, in healthcare. And there are issues of privacy, confidentiality, issues of security. Maybe sometimes people don't want to share the data. And so it will take some time.
Can I make
all these issues.
Can
Yes?
I make a comment here?
Please,
now, we haven't, Prof. Patrice mentioned bringing together all this data to provide personalized medicine, but we haven't mentioned the role that genomics is going to play.
Gene
the same
sequencing.
medication response, patient response can be different, and once the data comes in from human genomics, you are talking now of being swamped with data. Then with the multiple sensors, implantables that patients are wearing and using, you have even more data coming in. So every individual patient is a source of big data. How are we going to cope with all this and provide the right treatment to the right patient at the right time?
Yeah. Well, is this the same like gene sequencing of everyone?
Yes. Yes. You not only have your regular genomics, you have your epigenomics. So each individual is a different person. And the medicine prescribed for one may not work for another. The same dose is not right for every patient.
Yeah.
And we are nowhere near addressing this problem.
Okay, Dato, back to you. You mentioned about Uberization, right, of health sector. Actually, our current Director General coined in this term, right? Could you elaborate further? So it's mean like all private and public clinics will be integrated in providing healthcare?
I don't know whether Uberization really means you can pick and choose your services you need. And that is largely from a consumer point of view. You know, he look at the number of healthcare providers, including some of our former students who have opened up services like Doctors. They have seen gaps in the existing healthcare services. The government can only provide so much. Hospitals can only provide so much, but the patient is at home 365 days a year. He might interact with a healthcare provider maybe 3 days, 4 days in a year, including an admission, maybe a total of 15 days a year. He might be under supervision of a healthcare provider. The rest of the time, he's making decisions every day that affect his health. Start with just, let's talk about diet, what he eats every day. You know, that makes a world of difference to his health outcome in 20, 30, 40 years, how he will age. What about exercise? What habits he has? How his diabetes or his hypertension is aging brings on a whole lot of chronic diseases. So the question is, I think you will be buying or receiving healthcare services. You will be using your own knowledge. You will be accessing the internet. You will get right and wrong information. So just like renting a car or sharing a car to go to a destination, you will have to use healthcare resources. You will have to use your peers. You will have to use family members. You will have to use what information you can derive from the internet. Maybe there's some simple solution in the future, but I don't see it coming anytime in the next 20, 30 years. Maybe AI will have a role to play, our personal AI.
Yeah, Dr. Hanis, would you like to add anything? What is the current status on in this Uberization, you know? Maybe you have some insight.
Urbanization, okay. So what comes into my mind is actually giving good healthcare access to the rural area. So to do that, you know, rural area, how we want to reach the rural area is now via road, right? So we ride a car or any transportation that we go. But by using good telecommunication services, you can reach to the rural area and give healthcare services. For example, remote ultrasound. We do the ultrasound via video conferencing, and also remote robot surgery, and then also teleconsultation for subspecialty cases. So if the patient is bedbound and cannot go to the Kuala Lumpur to seek treatment, and then the consultant can give consultation to the rural area. So this can be achieved by setting up, like for example, 5G tower. So if you have the 5G tower, and then we can bring the healthcare services to the rural hospital, for example, in Sri Aman, Sarawak. And then at the same time, if we have good telecommunication services, we can attract more people to the rural area and work there, because they can, even though they are at rural, but they still can connect to the other people outside from that area. So for me, this the urbanization tactics in the rural area is very promising in the future. And actually, because the ND is trying to set up the 5G throughout the country, so I'm seeing this is possible in the very near future. And I really hope it's a success lah. Yeah.
Yeah. Okay. Just now you mentioned about robot and robotics and robotic surgery and all that.
Yeah.
Just want to know how well the patient received this treatment. Because although I'm a fan of technology, but I just imagine, like, how you engage or humanizing these procedures,
Okay, so I think for robotic surgery, honestly, I don't deal directly with the patient that receive treatment using robots. But robot surgery, you need very skillful surgeon, and how the surgeon convince the patient to get that kind of treatment. For example, if the surgeon wants to use laparoscopic surgery for acute appendicitis, it depends on the surgeon's confidence level to do it, and how he can convince the patient that if you use the laparoscopic surgery, it will be time saving, you can heal faster, etc. But it is a matter of training the skills to the right people, because I don't think there are many people that are interested to learn the skill. Yes.
Yeah.
But it's a good thing to put in mind along the pathway of digitalization.
Yes, Dato, you would like to say something?
Yeah, doctor, actually today, if you are going for a urological procedure in this country, it will be almost in any of the big hospitals, it will be done through robotic surgery. Your prostate will be removed that way. Your, more complex robotic, more complex urological operations. And the other discipline, they were the leaders in this country in the use of robotic surgery. I think their patients don't question them anymore, because it has become a routine part of the service in urology. Other disciplines are beginning to move in this area, and it's a matter of time when you recognize that smaller incisions, quicker operations, faster healing, and ultimately lower cost. Although the initial purchase of the robotic system is expensive. So inevitable that it is going to become part of our lives in future.
Yeah.
That's good to hear.
I think for creating awareness, we should publish this data at national level, how many robotic surgeries successfully we have done. And that would actually create more awareness that, like, even in dentistry also and in brain surgery also, I read somewhere they are using robots, and even backbone, knee replacement.
Yes.
Yeah. So, right. Back when we were discussing about data, like Prof. Patrice, you also highlighted data, right? I was thinking, and I would like to seek feedback from all the three panelists. We should be using, I think Tatuja highlighted a bit like last time, Tan Sri Abu Bakar was more on well-being rather than treating patients. So could we channel all this huge amount of data, and how we could actually use this data for well-being of a nation or a human? You, Prof. Patrice, or anyone first?
I'm not sure. Maybe Dr. Jai first.
Yeah, sure.
Okay. You see, the approach we have taken in the Ministry of Health that was written out in the telemedicine blueprint is that we focus on periodic health visits throughout life. So we already have the system in place. You know, mother gets pregnant, she goes for antenatal visits, she is screened for risk factors. Risk factors are managed early so that you have a outcome is a healthy delivery, safe delivery, and a healthy baby. Then in childhood, the baby from 6 weeks of life, 3 months of life, 6 months of life, 12 months of life, right through early childhood, there are periodic health visits. And templates exist, which are used by the health providers to ensure the right care is given, whether it's developmental assessment or immunization or growth monitoring. So the idea is to keep the individual in the highest possible state of health and to address risk factors as they address. If you do this, then what will happen is you prevent disease from developing. Next stage is, yes, if disease does develop, you want to detect it early. 50% of diabetics are not, undiagnosed, and they get complications because they are not being treated early. So in future with genomics, we'll be able to predict who will get what diseases and what their likely long-term outcomes are going to be. So the whole idea is anticipating, monitoring, screening, wellness visits, and this is the direction of our healthcare. Unfortunately, there are countries where US is maybe a prime example where money is made in the treatment of illness. And there's a very strong focus on illness. But I think you'll agree with me in Malaysia, in France, for example, in Australia, in Canada, it's a very strong wellness-focused health systems where periodic health screenings and early detection of risk and management of risk keeps people in the highest possible state of health. But having said that, there is still a gap. That means there's on an average per country, there's a 20-year-old gap between your lifespan and your health span. The lifespan meaning when will you finally die? The health span meaning when do you stop becoming healthy and start getting sick? And on an average, this is about 20 years. So while most childhood, early life diseases have been managed, it is the illness part at the end of our life that is beginning to be, which needs to be addressed. And that is why we have all the studies on aging, what causes aging, is it possible for a health span to be expanded, and can we live a life full of health until the time when we die? That is the focus of much research going on at this time.
Yeah, thanks, Dr. for elaborating. Dr. Hanis, anything we would like to add?
Okay, so data is very interesting and I really like to play around with data. But before we get the data, before we get to the data, we have to put in mind that we want the relevant and good quality data. In order to do that, if we are still working using a manual process, it seems impossible for the big health data, right? So we have to implement good information system at the primary care level. So at the moment, the government or clinic in the government are using the TPC or CHIS system, the tele-primary care oral health clinical information system, where so all patient visit, they will put inside the system and do all the clocking and everything inside the system. And at the same time, the vector unit, the infection control unit also using the system. So by integrating and collecting all data from the system, we can use this data to do a mapping. For example, in COVID, we do the geographical information system mapping to know where is the pandemic area. So that is for COVID, and the dengue also we can do that. and then we can do targeted promotion at the locally. Okay, and then at the same time, if we have enough and we know how to use this data, actually, we can do a prediction modeling of how the patient well-being in next 10 to 20 years. So if they have this demography, the possibility of the patient to get diabetic is how many percent, or probability of you getting diabetic in 20 years is how many percent if you don't change your lifestyle. So this is the usage of data at the primary level. This is part of the many usage, but if you are focusing on the well-being, to promote well-being, to maintain the health status, definitely data is the way forward.
Yeah. Prof. Patrice, there was a joke I read, like someone goes to a fast food and orders something, and based on the data integration, the person at the counter tells that you don't have enough funds. Then he orders something else. And then the person again, the salesperson said, oh, you have this disease, that's why you cannot order this. How far do you think this joke is coming true now? And what would be the drawback? Because it's a double-edged sword, no? If this data goes to wrong hands.
I think it will take some time. There is a technology aspect, but also privacy. You don't want everyone to know about your condition, your health data. So this is a big problem. And I was thinking previously when talking about data and information to the people, one of the biggest issues that we had during the pandemic in Western countries, not so much in Malaysia, was fake information about the virus, the vaccines, and all these things. And as long as we will not be able to solve the problem of fake information, it will be a very big problem, because there will be another pandemic coming. We don't know yet when, but it will happen. And there are other issues. And we have to be sure that the fake information will be blocked. For the moment, it doesn't happen yet, and we don't know how to solve it. But this is one of the biggest problems we have.
Yes, so you're saying like be careful in sharing the data, right? But if we don't share this part or this type of data with healthcare setting, as Dato also highlighted, the living style, what we eat, that affects our health.
Yeah.
So I would say, like, what if our physicians, our surgeons should get that type of data? No? So that's what we do in patient history, right?
Yeah. But you have to know with whom you are sharing your data, and you have to accept to share with some people and not to everyone. Yeah. And this has to be protected.
Any technology which can do that?
I don't know. There are some ideas, but nothing completely. Nothing completely secure at the moment.
Right. Okay. Back to our participants. If anyone would like to ask questions, you can type in or raise hand. Our technical team give you mic, and you could even ask live questions. If not, then I have one more point to raise, and I think, Prof. Patrice, you have put in about image processing. So what my panelists do you think about the future of like Watson machine, IBM Watson, and image processing? I think technology is far ahead than a human being. What do you say? Can you add, Prof. Patrice first, then Dr. Hanis, and Dr. Jaya then?
I'm not sure. Yeah, the technology is very powerful. It is used in many domains. Image processing is something that is quite old. I used to teach image processing in the 80s in Paris, but it has changed so much in 40 years' time. The progress is considerable. So yeah, in fact, there are so many data coming from image processing that we are not able to use all of them at the moment, but it's something that is very useful. Yeah.
Right. Dr. Hanis?
So for image processing, it's I think it's the one of the latest emerging technologies, right? So when I was doing my assignment this year or last year, then I read this article saying that it's about like this. It's saying that technology advancements is healthcare is always behind compared to other industries. So there are many reasons for that, which I'm not going to elaborate now. So image processing requires a very high-end technology, but at the moment, we don't even have system throughout the country in all our hospital and clinic. So I think we should set a standard, a strong system first, and we have to prioritize what technologies we want to use and what problems we want to solve with these technologies, because not everyone out there, and I think most of people out there are still not technology savvy. And sometimes if we do if we implement the HIS, for example, if they want to troubleshoot, like, oh, I cannot turn on the computer, they don't even know how to troubleshoot themselves. Like how to check the plug, is it turned on or turned off, or how to check the connectivity. There are still a lot of people out there that they don't know these basic technology things. So of course, the image processing is something that is very high end, but we should put in the plan. But throughout the end of the tunnel, the current system and the upcoming system should be planted very strong first.
Yeah, so you're highlighting like it's a specialized field, right? Yes, Dato,
Yes.
please.
Okay, I went to the States in 1999 with actually Tan Sri Dato Dr. Abu Bakar to look at the technologies they had in place. And at that time, reading of X-rays, what they used to do is they take the X-rays are digitized and sent to India. And they were read and they were interpreted in India. And the radiologists in the US just counter checks to make sure that there are no obvious errors. So by the time they come to work next morning, the film's already read and reported. Today, of all the occupations where the health professional is most at risk of not having a job is radiology, because computers, robotics read films faster, more accurately. In one day, they can go through more films and make reports more accurately than a radiologist can do in a whole year. So while they said that other health professions, so what we have to recognize is that the combination of automation, robotics, and the other new technologies, artificial intelligence, the right use of them can actually not put people out of a job, but allow people to do more value-added services and provide the sort of services that robots will not be able to provide, although the gap is beginning to narrow. So I think we have to shift to robotics. And the robot need not be here in Kuala Lumpur, in every one of our hospitals, can be anywhere in the world, and we can outsource that service. So that's not too difficult to manage, but need to budget and plan for it.
Yeah, I wish I could continue, because the way I'm really enjoying the conversation and discussion, but we are born to a program, and the most exciting part of this event, our International Learning Resources Festival, is next to our forum, and that is the award giving ceremony. So I've been asked to close. So final statement, maybe 30 seconds of to each panelist. We start with Dr. Hanis, maybe.
I think for whoever trying or ever thinking about want to learn technology, you just have to go and learn, because for me, something that is learnable is it's doable, and at the same time, there are a lot of free resources. But I think you should have a mentor to guide you so that you don't fall out of the path.
Yes, Dr. Jai.
When I joined IMU about 20 years ago, medical knowledge used to double, they said, every 2 years. IBM now says that medical knowledge doubles every 2 hours. So how are we going to stay relevant and do the best for our patients when medical knowledge and development and technology is growing so fast? I have not heard a good answer to that one, but I think it is something that all academics have to address one way or the other.
Yes, Prof. Patrice,
Um,
do you have answer?
Yeah, no, I'm thinking of when I was, I think I was finishing my PhD in France. I was working in a cardiology hospital in a clinic in Paris at the same time. And I developed an information system for the clinic. It was in the 80s. So it was, I don't think there were many projects like this one at the time. And I worked during 5 years approximately with the doctors, medical doctors and cardiologists there. And it was funny because I was just beginning working in computer science. And now I can see the progress. I think maybe I should have continued working on this at that time.
Yeah, so it's never too late. Okay, so I would like to thank officially to all our panelists and distinguished guests. So back to our MC.
Thank you.
Thank you. Thank you.
Thank you.
Thank you. Thank you, Prof. Patrice, Prof. Dato Mohan, and Dr. Hanis for sharing with us your valuable experiences and your knowledge on this interesting topic.